Imagine the most cruel paradox you can conceive. Not war, not a natural disaster, but a tragedy unfolding right in the comfort of a bedroom under soft yellow light. A mother, out of love, wanting to soothe her teething child's pain, reaches for a jar of pure white powder on the shelf. She carefully sprinkles it into the baby's mouth, believing she is granting peace. But she doesn't know that powder isn't medicine. It is a slow death sentence. For decades, thousands of children endured physical torture so horrific they tore at their own flesh. Doctors of the time called it pink disease, an innocent-sounding name, but behind it lay a medical nightmare fueled by ignorance and a deadly chemical element, mercury. Welcome to today's Dark Dossier. We are traveling back in time to witness the Calomel Tragedy. To understand why this tragedy occurred, we must return to the early and mid-20th century. In the UK, Australia, and the USA, this was the post-war baby boom era. Children were the center of the universe, but raising infants was never easy, especially teething. Crying, fever, constipation, and pain left parents exhausted. They needed a solution, a miracle. And the market answered that prayer with flashy names: Steedman's soothing powders or Moffitt's Teethina. These powders were advertised as a panacea. Packaging instructed parents to administer them frequently, even daily, to keep the child good, cool the blood, and cure constipation. It became an essential item in the medicine cabinet of every middle-class family. But what was the secret ingredient creating that magic? It was calomel, or, to use its precise chemical name, mercurous chloride, Heg2Cal22. The use of mercury in medicine was not new. Since the 16th century, the famous alchemist Paracelsus popularized using mercury to treat everything from syphilis to skin diseases. By the 20th century, calomel was considered safe, an effective purgative. Doctors of the time believed calomel passed through the digestive system and was excreted without being absorbed. That was the logic of the era, a deadly logic. They did not foresee that when introduced into the fragile bodies of infants day after day, a biological tragedy was silently accumulating. A chronic mercury ingestion was waiting to explode. When children swallowed that white powder, calomel didn't just pass through the gut. For some children with a specific sensitivity, idiosyncrasy, their bodies began to react to the inorganic mercury in the most devastating way. Let's go deep inside the cells to see the true horror. The mercury began attacking a crucial enzyme called catechol-O-methyltransferase, or COMT for short. COMT's job is to break down catecholamines, a group that includes epinephrine and adrenaline. Simply put, COMT is the brake that holds back the adrenaline in your body. When mercury disables COMT, that brake is destroyed. The infant's body is flooded with adrenaline. Imagine the feeling of a near-miss car accident, heart pounding, blood pressure skyrocketing, cold sweat breaking out. That sensation lasts only a few seconds for an adult. But for these children, that state lasted forever. They fell into a state of chemically induced hypertension and tachycardia. Their tiny bodies were running a lethal marathon with no finish line, and then the external symptoms began to appear. A medical condition known as acrodynia, derived from Greek, meaning painful extremity, but its folk name is far more haunting: pink disease. Why pink? Due to vasomotor disturbance, the children's hands and feet transformed. They weren't a healthy pink. They turned a raw beef red. When touched, you wouldn't feel the warmth of life, but a sensation that was cold, clammy, and wet. The body tried to expel the heavy metal through every possible avenue: sweat glands and kidneys. Mercury destroyed the renal tubules, causing the children to sweat profusely, leading to severe electrolyte imbalance. This constant dampness, combined with the toxins, caused the skin on their hands and feet to begin dying. The skin peeled off in large sheets like old rotting gloves. Desquamation. In the most severe cases, fingers and toes began to turn gangrenous black. But the physical torture didn't stop there. The peripheral nervous system was under attack, causing horrific neuropathic pain. Intense burning and itching, paresthesia, tormented the children day and night. The itch lay deep beneath the skin, where no fingernail could reach. The children rubbed their limbs frantically together against the crib bars, against the bed sheets. In a frenzy of itch and pain, they tore at their own delicate skin, leaving open, weeping wounds. The most characteristic sign of mercury poisoning was stomatitis. The gums became swollen, red, and inflamed. Saliva drooled uncontrollably. And the most terrifying part, their teeth began to loosen and fall out. In some cases, permanent teeth developing inside the jawbone were pushed out before they could even erupt. The child's mouth became a ruin of decaying soft tissue. Psychologically, the mercury toxin caused extreme neural irritation. Clinicians used the phrase profound misery to describe the victim's state. They cried piteously but could not be soothed. They suffered chronic insomnia. They developed photophobia, always trying to bury their faces in pillows to hide from the sun. Their muscles were so weak they lay limp like rag dolls. Their parents could only watch in despair. They would pick their baby up, sing a lullaby, and then give them another dose of teething powder, hoping to soothe the pain. They were pouring gasoline on the fire without even knowing it. For years, medicine was completely stumped. The mortality rate reached 10% to 30%. The children didn't die directly from the mercury, but from secondary bronchopneumonia or electrolyte depletion because their bodies were too weak. Doctors blamed viruses, pollen allergies, genetics. It wasn't until 1948 in Cincinnati, USA, that the curtain was lifted. Dr. Joseph Walkeny and Dr. Donald Hubbard decided to do something no one had thought of: test the urine of children with Acrodynia. The results published in The Lancet were a shocking revelation. The mercury concentration in the victim's urine was astronomically high. The link was proven, not a virus, not an epidemic. The culprit was the teething powder sitting on every family's shelf. The reaction that followed was slow but decisive. In the US, the FDA banned the shipment of mercury-containing powders around 1950. In the UK, the reaction was a bit slower. It wasn't until 1953 that calomel was removed from Steedman's formula. However, the tragedy lingered for a few more years as old bottles remained in households, passed down from mother to mother. But the final result was undeniable. As soon as calomel vanished from the market, pink disease also vanished from medical literature. It disappeared completely, as if it had never existed, proving that this was a disaster created by human hands. The story of Acrodynia and the Calomel tragedy is a chilling reminder of the limits of medicine and the danger of blind faith. We often place absolute trust in what is labeled medicine, in long-standing brands, in traditional methods. But history has shown that the line between a miracle cure and a poison is sometimes as thin as a paper powder wrapper. The children of that generation, the survivors of the pink nightmare, are now in their 70s and 80s. Perhaps they no longer remember the pain, but the invisible scars of an era where parental care unintentionally became a weapon will forever be etched into medical history. If you find this story horrifying, remember to double-check what you keep in your family medicine cabinet, because the truth is sometimes scarier than horror fiction. I am your name, channel name, and I will see you in the next dark file.